Hey everybody, it's Dr. Appleraju again with a Concept Dental Moment. This time, the question is, would you shoot someone? Literally, would you take a gun and shoot somebody? Well, this question was posed years ago when I was at a sedation or anesthesia conference, and most people pondered for a second and they thought, well, no, I wouldn't really unless they were harming my family or myself. Well, here's a different perspective and why it's related to your health. Well, the question was, would you shoot somebody if you had a gun? And most people would probably answer no. And the question would be very differently answered if you were presented with a different situation. So here's the situation. If somebody were to hold on to your nose and cover your mouth and continue holding your nose and your mouth so you could not breathe, there's a drive, it's in your brain stem, there's a center, controls breathing, and your drive would be very, very, very strong that you would do anything that you had to take a breath. And that drive is very significant. Really, if you don't breathe, you don't thrive, you don't survive. So that breathing center controls a very powerful behavior that we do very unconsciously every day. Most of us don't even think about our breath, short of if you're meditating or doing some sort of mindfulness procedure. That's when you focus on your breath. But the point is, most of us, given that situation, with our mouth covered and our nose covered and we're not able to breathe, would probably pick up a gun if we had that opportunity and perhaps shoot somebody who was obstructing that behavior. Okay? So why is that significant for you? Well, that is how strong that drive is. And if you do have significant snoring, or if you do have significant sleep apnea, or any apnea for that matter, apnea means you stop breathing when you sleep. And typically people will gasp significantly for that breath of air. And how does that relate to your mouth or your health? Well, if you are not sleeping properly, meaning you're not getting breath when you're unconscious and fast asleep, well, you put your whole body in inflammation, a state of inflammation. So that is an underlying current for a lot of the health epidemics that we're suffering with in North America or most Western worlds. If you have chronic inflammation, it's the root cause of pretty much any type of health concern that we have, whether it's cancer, dementia, Alzheimer's, arthritis, diabetes. I mean, you just think of any of these types of things that happen on a chronic basis in our healthcare system, and that most of them are underlined by chronic inflammation. Well, if you're not breathing, you're in a state of chronic inflammation. What's the other part? Well, your brain isn't cleaning itself properly, and you're not getting what we call deep, refreshing sleep, which is essential to learning, to functioning on a high level, to focus, to memory. All these areas are affected by your lack of sleep. Okay? And specifically in this talk, it's related to lack of oxygen in your system, or lack of transfer of oxygen from your lungs out into the environment and back in. So why is that significant from a dental perspective? Well, we often ask our patients if they do snore significantly, if they have sleep apnea, if a partner has ever said, hey, you stop breathing or you're gasping for air. Most people are unaware of this because typically this is happening in your deep REM, rapid eye movement type unconscious sleep. You're not going to be aware of it unless you have a monitor. And for our patients, we do refer them free of charge for free sleep testing. And I don't read that report. It's read by a sleep physician who sends us a report, and then we can make a diagnosis chairside with that report about what your options are to treat that. For many patients, it involves CPAP therapy, and CPAP is 100% effective. Most doctors prescribe it. It's 100% effective if you use it. And the history is most patients will find their quality of life improves. Some patients, borderline patients, may not think it's helping them and may take that machine and put it in their closet after a month or two, and they don't realize the harm they're doing to themselves. Now, there are some dental devices that can advance your jaw, but sleep apnea is a very complex and sometimes controversial area. The dental devices perhaps work in 60, 70, maybe 80% of the cases. They don't work for everybody, and what we found is some patients do benefit from them, however, not everybody does. And so it's not 100%. And most doctors, medical physicians, if you talk to them, typically are going to prescribe CPAP because it does work. It's pushing air into your lungs to help this process of oxygenation of your blood, right? And help you get good sleep and all those things I just mentioned. However, some patients don't find it very sexy. Having a mask mind you, they have gotten better. The units have gotten improved. The technology's gotten better over the years. So I'm finding most of our patients tolerate CPAP a lot better than they used to. But there are a few, no matter what you do, they have challenges adapting to some new technology and literally things that are life-saving. So if you're driving down the highway and you think you've had a great night of sleep, and you tend to be nodding off, falling asleep, you might want to consider maybe you're not getting enough oxygen when you think you're sleeping, and get assessed. I mean, it's easy. Take a device home. I've actually done it myself. Fortunately, I didn't have any apnea or episodes. I just snore periodically, but snoring doesn't necessarily mean you have sleep apnea. Sleep apnea is a little more serious health concern, okay? Typically, it's meaning that you're stopping breathing. That's significant, okay? So, back to the headline of this post. Would you shoot somebody? Most people aren't going to do it, but if somebody's obstructing your airway and stopping you from breathing, most people will, because that's really the difference between life and death. Your breath is everything. You don't breathe, you don't survive, you don't really thrive. Just keep that in the back of your mind. If you do have a loved one that's suffering with significant snoring or possibly gasping for air while they're asleep, get them referred, get them tested, whether it's through a dental office, through your family doctor, through some respiratory centers, get them assessed. It is a significant health problem in the Western world, and you don't have to be overweight, you don't have to be short, you don't have to be having a big thick neck. This can happen in kids, it can happen in slim, skinny people as well. There's a lot of different reasons for sleep apnea. They're not only physical, they could be a central nervous system issue, a physiological issue, an airway issue, so there's a lot of different components, but please get assessed if you think you or a loved one may have sleep apnea or significant snoring. It could be saving their life. I hope this was helpful. Take care, everyone, and stay safe out there.